right, now what?
Sit down here, I'm gonna take a picture. Like leaning forward, like looking out into the cows.
Is this my good side?
I think so.
All right. Which arm? It's like I don't know which hand.
This arm looks more muscular if you have it in this arm, which I know you like.
That's what we're going for.
I can see your flexing.
Come on.
Okay.
Here we go.
Okay,
1,
ready?
2, 3.
Actually, that is really great. Work it. Look.
Milk model there.
Wow.
The things I do for this business.
You love it.
Hatcher Family Dairy is a family-run business. I head up the farming operation, and my sister heads up the vet clinic.
Oh, poor baby. Between all of our animals and the vet clinic, there's never a dull moment. You're so fat you can't roll over. We all work together, play together.
Can I hitch a ride?
I guess. But at the end of the day, we all know what the common goal is, and that's the farm and the family. Well, you got your boots on, ready to roll?
Yeah, I came prepared. They wore all black in case I get...
Some doo-doo on you?
Yeah, I learned that lesson the hard way. Charles and I have been married 1 year and 1 month. We are newlyweds, for sure.
What are you doing here?
Just hanging out, trying to get some quality time with Charles.
You know, growing up, I remember in high school, whenever I milked, my friends would come milk with me because it's the only time I ever got to do anything.
Oh.
Look how short that one is. Who's that in the third hole?
I think that's Shimmer.
How did you know that?
Well, I can tell you who they are just by the udder. When they come in the milk barn, I can tell you who they are just by their udder and their teats. I'm that good.
I've always heard about this talent of yours, but I've never seen you actually do it. I don't know if I believe it.
Don't doubt me. I know my udders.
I think we should play a little game. I went through and wrote all of their names down in order, so when we leave Charles in here blindfolded, he can tell us who they are.
Are we good?
Yeah, we're good. Come on.
So we're gonna see if he can get 100% or if he fails today. If he's really an udder man or not.
Okay, with all the confidence I have, if I don't get this right, they're never gonna let me live this down.
You seem nervous.
Let me start right here. Sandy, Sophia, Minnie, Charlotte. This one here, May, but I know that's not right. Same kind of udder. Shine, Zolly, Aretha, and Brooke.
Okay.
Pretty good.
Yeah, I mean, you gotta give it to him.
I know udders when I see them.
I don't know if that's something you want to be shouting out or not.
Right? I'm the 5th generation farmer to be on this exact farm, so my family's had it for nearly 200 years. And that's just awesome for us to carry that legacy on. And the number of dairies are dwindling almost 50% the past 7 or 8 years here in this state. One of my biggest fears is this farm being in jeopardy. The average age for farmers now is mid-late 60. For people in our age bracket to be able to do that is really rare in today's day and age.
Come on, girls! Come on, girls. Being a full-time veterinarian and full-time farmer, your day never ends. You're go all the time. Good deal. Everybody's accounted for. Now I can start my day. Here at Hatcher Family Dairy, we have just a little over 200 acres that includes the dairy farm, our creamery, all of our family dwellings, the vet clinic. Our tiny little vet clinic is a mixed animal practice in a rural setting. In some days, counted up to see 10 different species in a day. I have seen about everything that you could possibly imagine. Good morning, Paula.
Hello, my friend. How are you today?
I'm good. How are you?
Good. It's been busy.
Well, who is my lovely assistant today?
She's always available. Mama assistant.
I once had a farmer tell me he's not sure what my mother actually did, but he did know that if she was not there, that nothing would work. You want to swap with Paula today and answer the phone for a while?
No. We don't want to do that.
Well, we have to go castrate 2 1,200-pound bulls. We're gonna lay them down. Can you handle that?
I will be answering the phone, Paula. Show me how to do it, and I'll how to do all this. Okay.
All right, well, let's get to work. My dad started this practice in 1992 at this clinic. I knew at that point from being very small that I wanted to be a veterinarian and wanted to work with my dad at his practice. And then he went and worked for the state, and I took over the practice in 2005 when I graduated vet school. All right, slide over into the room. I learned everything I know about practice management, managing clients, a lot of my veterinary education from my dad.
Hi there.
Hi there.
What have we got going on with Denver?
Her anal glands are not good again, and she's had issues with those before.
Okay. Denver. Let's go.
Denver is one of my canine patients that I have been seeing for many years now, and she's come in today to check her anal glands. Sometimes she can get really nervous, especially when we're dealing with her bum.
Okay.
And Mom said she's been biting her when she tries to look at her bum.
Oh, okay.
So I'm going to
So we're gonna
slide
be-
a little muzzle on
So
her.
we're going to be extremely careful.
It's okay.
When Charlie retired as a veterinarian, I retired as a vet tech. The clinic's been a little short-staffed, but I'm jumping in and helping.
It's okay.
In my heyday, I had 15 to 18 years of vet experience. It's been a while, but I think I'm gonna be just fine.
You're tense. It's okay. Oh. Oh. It's okay. Shoo.
I forgot how bad anal glands smell, and they are the worst.
Stinky.
I love to help Jennifer, don't get me wrong, but I'm holding a dog with a muzzle, and I gotta get back in the swing of things.
Oh, her bottom is really crusty. I'm gonna be really easy. It's okay, good girl. Denver has had a history of anal gland issues. The purpose of the anal gland is a scent. Kind of lets other dogs know, hey, this is where I pooped and my name is Denver. Anal glands are nice and soft. If they're hard and painful and the dog is really reactive, then oftentimes that may mean that we may have inflammation or infection. The anal gland is good, but this one is infected. I do want to be cautious, as sometimes persistent and reoccurring anal gland infections can mean something more serious like cancer. They don't always release when they defecate as they're supposed to. I'm gonna try to express it unless she's really painful. So just as a good girl, it's expressing, it's coming. It can be very uncomfortable because you have to stick your finger and kind of milk that sac, and the opening is very small. So if the fluid within the anal gland and sac is very thick, oftentimes when it's infected, it's like pushing peanut butter through a pinhole. So this is all the nice stuff that just came out of her rectum. And it's what we call inspissated, that's little chunks of pus. Okay, we can set her down.
Okay.
So feel very confident that we're just dealing with an infected, impacted anal gland today because it's part of Denver's history. Good girl, you did good. Yay! Our next steps at this time is starting her on an antibiotic and to also start her on something for pain inflammation as well. However, to be cautious, we want to make sure and recheck that to make sure we don't have any other issues.
She was so good. She does have a little issue with her anal glands, and Jennifer says she'll talk to you about that.
Okay.
Yeah, but she
thank
was very
you.
sweet.
Thank you.
Okay, all right, bye-bye, Denver.
I wish veterinary medicine was all cute puppies and kittens and puppy kisses, but it's vomit, it's maggots, it's diarrhea, it's anal glands, rotten calves, it's all of that. And I wouldn't trade it for the world.
Hi, girls.
Hey, Charles.
Yeah.
Got a hurt cow over here, hunger foot or something, is bleeding.
You gotta be kidding me. What'd you do, Callie? Oh yeah, I see a little blood. Callie is one of our 4-year-old hatcher ladies, and she's one of our biggest and most productive cows, so I hope nothing's wrong with her. Oh yeah, it looked like it scraped the fire out of at the top of the hoof there. So it looks like Callie has caught her hoof in something and has completely taken the sidewall off of her foot. From what I can tell, it's down to the tissue potentially, which causes major concern. I think we need to get her a place where we can hem her up, get it hosed off, put some cold water on it. Don't worry, Callie, we'll get you taken care of. Here we go, Callie. We'll get her in that middle pen and see if we can get her in the dairy barn. I want to hose it off and look at it. Turn your head. No, 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 no. Well, if she does that, that's okay. Wow. I mean, she got it hung or scraped on something big time. Can you see what it's... Is it coming from the top or down there at the bottom? It might be top. Like it's pulsating out. Good night. Dang, she hit an artery. This is worse than I thought. I'll get Jennifer down here pretty quick because we need to stop that. Dang, she hit an artery. I've seen a lot of foot things in my day, but that one right there might take the cake.
Oh, God.
See it?
When I go into the milk parlor, I can't believe the blood that's on the floor. Charles was right. It's a catastrophe. There's blood everywhere. This is something very serious. It peeled the whole part of her hoof off. I've never seen a foot injury this bad. She could possibly bleed out.
I don't know what in the world happened. It's almost like drug her foot down the road. Be careful with her,
That's her laminar tissue poking out. We obviously want to put pressure on Callie's foot to stop the bleeding, but it's not safe at the moment. We don't have a proper way to restrain her. We just need to get her up to the clinic and put her in the chute. And we'll sedate her a little bit.
Yeah, that's what I figured.
No, we need to get her up there pretty quick. Because she is pumping blood, it's just continuously coming out. If we don't do something, the bleeding is going to continue. We could lose her. Okay. Let's see. I'm going to give her just a titch of sedation. Just a little bit to relax her.
You're all right. Gonna help you out. We never like it when any animals are under stress, but when it's one of your own, it adds a whole emotional element to it. All right, we'll go ahead and pull the foot.
Yeah.
Good.
So now that she's sedated, I want to pick up her foot where I can clearly examine it and look for those bleeders and see if I can isolate them and stop the bleeding.
Uh-oh, you want to let it off?
Let it off.
Oh.
Yeah, now she just sat on it.
What do you think?
Callie has gone down to the chute, more than likely due to pain. She could be weak at this point and even be in shock.
Being in a situation with an animal that is in pain, it's really hard when there's something that's beyond our control.
Shoot fire.
Well, here, I'll have to let the side open. And don't let it hit back on you. I don't think it goes down.
Ooh, watch it. Right.
Come on, girl. Can I get to the foot at least down there?
Oh, yeah. Yeah, perfect.
We're at a life or death situation, so you adapt and innovate and try to make things work. See, you can't suture that. It's in that tissue. With this particular type of tissue, you're not able to wrap a piece of suture around that and tie that off. I can't suture, and I'm not able to grab it. So my third option is to use cautery, which is just heating that area up and providing heat will kind of stop the bleeding. So I use a dehorner tool. It produces heat really quickly, and it's got a big surface area in which I can try to get the bleeding to stop. I'm sorry, girl. Oh, go down. The cautery did slow the bleeding down, but not completely. Let me see if I can get a clamp on it. My next thought is to grab those tiny little bleeders and clamp it off. I'm trying to find the artery. If I can find that bleeder, I can twist it and it'll kind of tighten down like a rubber band and prevent bleeding from happening. The problem is it's right at bone. Boy, she did a number on that foot.
I've never seen anything like it. Anytime there's issues, our family drops everything they're doing, our farm team drops everything they're doing. You go all in for these animals. You know, we care about them and we depend on them to keep our dairy going.
Good, it's stopping. So pulling the one artery took care of that bleeder. Doing some cautery did slow it down and help it. And now we're gonna apply pressure at this point. It's like a bloody massacre.
Yeah.
Good gosh.
We left a crime scene walking all the way up here. You got it right there.
She's starting to bloat. We gotta get her right. Cattle constantly producing gas. And so because of that, if they lie on their side and can't sit up and burp, all that gas will get trapped and cause respiratory distress and they can die. We gotta get her up quick. When a cow lays on her side and she can't belch or burp, that gas will blow up in the rumen and they can stop breathing. The longer that Callie is down, the greater risk of her dying. 1, 2, 3. Can you get up? We gotta get her up quick. We just had one life or death emergency with Callie, and how we have another one. 1, 2, 3. 1, 2, 3. There we go. Can you get up? Okay. So we've rolled her up at this point. Callie is sitting up, but we've got to get her to belch. She can't belch or burp. That gas will blow up in the rumen and they can stop breathing. Okay. You pink? Oh, yeah. Okay.
There's a burp.
There's a burp.
I feel better now.
Yeah. That's telling me she's getting that extra gas out and she's not gonna bloat.
That's a good one.
She agrees.
Yeah, she's burping a bunch right here. And let her sit there a second.
That belching or burping is allowing that gas to move out of the rumen and decompressing it to allow her to breathe better and to have more room. She doesn't look distressed, that's good.
Now it's on you, Callie. You probably got dogs and cats waiting in there on you.
I guess I probably ought to clean myself up.
Get
Why don't
up.
you hang with her?
Come on. Hey, hey, hey. Says, "No, I don't think so." We still got a long road to go. But on the other hand, seeing that Callie is stable, I feel like we accomplished our goal. When a 1,300-pound cow doesn't want to move, then she's not going to move. Yeah, see? Exactly. You want to try? Callie, come on. Ha-ha! All right. Excellent. Come on, girl. I know it, that hurts like a son of a gun. Seeing her get up on her feet and walk out of this situation, it's awesome feeling. There you go, get in that grass right there. We've all potentially saved her life as well, so that's very rewarding. It makes me feel a lot better. That's what you want right there. Dairy farming, you know, we get up with the chickens and go to bed with the chickens 7 days a week, 365.
But we get through everything as a family.
Whatever comes our way, we work together, we make a great team.
I'm gonna need y'all's help. I love chickens. Of course, I started with 8, and we had more and more people were like, wow, those eggs are great, you got more? And it just kind of grew because of the demand. But I've got a hawk that's stalking the girls, If you look out there, they're all in their coops because they're stressed and scared. When they get stressed, they don't lay what they normally would lay. So the hawk is not good for business.
No.
And I'm not tall enough to do all this. We do have predators here, people, and I don't want predators to get my girls. So I researched it and saw some iridescent pinwheels, and I'm gonna give it a whirl, no pun intended. I was getting like 70 to 80 eggs, and they were stressed yesterday and only got 45. So I was half, so that's no good. I mean, I'm desperate at this point. I don't know what else to do. I've moved my owls around. I've moved my tape around.
It's a lot of work keeping them away, huh?
Well, yeah, absolutely.
Too much.
Marrying into the Hatcher family, you have to have a sense of humor, and especially being married to Charles Hatcher.
Giving me heck about my chickens again. The family, they say I'm obsessed with my chickens. We're trying to help you ladies, but I take pride in my chickens and what I do.
Who doesn't like chickens? Everybody likes chicken. I don't blame the hawk. Chicken buffet.
It gives me heck about the chickens, but guess who first one that'll eat 6 or 7 eggs at one time?
More like a dozen eggs at one
yeah.
time.
I hope that pinwheels keep away that pesky, stalking hawk. Unhook it there, Mary, and then...
You can just leave Mary in there. She can scare the hawk away.
Rocking Country, this is Paula. Will you hold for me, please? Thank you.
At our family vet practice, we have an office that's there on the farm, which is nice for our farm animals. But we do have a traveling radius too, so I do work out of my truck.
God, this vet truck stinks. What smells in here?
Jennifer, it may be my boots. I need a new pair of boots. I think you buy your poor mother a new pair of boots. That'll work.
So this is my annual visit for Arden.
Okay.
So every year I go to Arden Ward's place to take a look at our goats just for annual exams and checkups and screening for disease. And today we're going to be vaccinating and pulling blood.
Now, back in the day, I was the blood tube person.
Well, you get to be the holder and the blood tube person today.
At the farm, I'm the boss, and I sign the checks. But at the clinic, Jennifer's the boss. But I'm coming out of vet tech retirement, and I may be a little rusty, but I've got my first case under my belt, so I think I'm good. Take me a little bit to get back in the swing. We'll see how it goes.
Hello, Fred!
Hello. I've been working with Dr. Jennifer at least 12 years, and she's much more than a vet to me. She's my friend, she's my sister.
You remember my mom.
How are ya?
I'm okay.
I haven't seen you in a while.
And I've met you before. You look really familiar.
Erin helps me a couple times a month.
Well, good.
When we're mucking and...
Because she said she only wants to handle the blood tubes. My mom. So we'll need somebody to actually hold the goats.
I'm your blood tube girl today.
All right, so I've got a list.
Okay, and they get cookies.
We've upgraded to cookies and corn chips. A little salty, a little sweet. Spoiled goats give sweeter milk.
That's true.
Most of my dairy goat clients live for their goats, and Arden is definitely one of those clients. They're a part of her family, and she cares for them, and it's really important for her that those animals are well cared for.
Come on, it's okay. Dr. Jennifer's here. Everybody loves Dr. Jennifer.
All right, so you get 3cc syringe, 2 mLs drawn up.
2 of this.
Yes.
Per
Shake
head?
it good. Yes.
Jennifer just throws them into the fire. She's forcing me to figure it out, and I'm gonna prove to her I can do it.
Okay, we're ready.
We're just gonna put her right up here.
It's fine.
Come on, pretty girl. She is 14 years old.
Unbelievable. She looks good. I'm going to pull her blood.
I'm putting the blood in the tube.
Yes, ma'am. Thank you.
Mama, you got to put it in there before it clots.
I did do it for years.
You did.
Yes, yes.
You did. But
Yeah.
then the chickens came along and everything
when
else
they were in
fell to the
college,
side.
I did a lot of it
Chickens
by myself.
took precedence.
Yeah, the chickens, the ladies did. I just kind of fell in love with the chicken world and the bookkeeping part.
Writing checks.
And writing checks, yeah.
All right, I'm going to get the next one.
Alrighty. Is this my next tube?
What do you mean your next two? No, that's used.
You don't have it drawn up yet.
Jennifer, I'm behind. I don't move as fast as I used to, and I don't think as fast on my feet, and I don't multitask like I used to, so therefore my children give me a hard time about that. The problem is you've given me too many jobs.
No.
Whoops. Mark that off.
Oh, nice, Sharon.
Look, I told you to let me
You got blood all over you. Hopefully we won't get pulled over on the way home. Yeah, look.
It's all right, I gotta get in the
Not very
swing of things.
biosecure. God.
When they were little, I could tie their shoes, cook dinner, I could answer the phone. So now maybe I can't. Give me a break.
I want to go change gloves.
Nobody got hurt.
Because that's the biosecure thing to do.
Okay, you need to bring me some?
Yeah.
I love my mom, but her vet assistant skills are kind of rusty. We have a very busy day today, and I need to speed things up to keep things on schedule. You want some corn chips?
You're all right, you're all right.
All
right.
Here, you hold her. And she's loose.
Oh, shoot, well,
Oh, good girl.
I even held her.
Do you need her head in here?
We've done it all.
She gets a raise. Okay, last but not least,
Lovey.
She's a Lovey. That's her name. She never met somebody she didn't like. Lovey is definitely a favorite. Lovey went on hikes with me this spring. She does love going hiking.
She does.
Come here, sweet pea. So Lovey has got an infection in all 4 feet. When they get sick, I want to do everything in my power to get them better. It just oozes, and I think
And
it hurts.
we're gonna culture it too. Look in between her.
I know. I can't get it to go away, this infection in the foot.
Is she lame?
Here's what I notice is that when I come home from work, she's separating herself from the herd.
Oftentimes when an animal separates themselves from the herd, it's kind of a sign that something is going on. This can be extremely serious.
You think she's painful?
She laid down on the trail and get up. Lovey has got an infection in all 4 feet that I've been putting ointment on and spraying for flies, and it's just not getting better.
Oh, I see ya.
See it?
Poor thing. That looks like it hurts.
It does hurt.
Arden thinks that Lovey may have foot rot or an infection of the skin between the toes. If we have foot rot, it's very painful and very uncomfortable and can make them lame. If an animal is lame, they don't want to get up and eat, they don't want to get up and drink, and so it's lots of problems, and this could lead to death. So I'm going to do a local block.
Yes, ma'am.
We'll hold that leg up, and I'll do a little punch. My goal is to get a little bit of normal skin and a little bit of icky. So if you'll steady her head, Arden, you steady her body.
So you're sticking
This
a
right
needle
here. I'm sticking needle
Okay,
in
I'm
this.
closing my eyes.
This is a numbing agent.
All right, Sharon.
Okay.
So what am I doing?
Pick the foot up. You just see how she acts, but I want somebody to steady her. She shouldn't feel this, but she may feel pressure and react. Ready? What I'm doing is a punch biopsy. It gives me a little circle piece of the skin. And then we're gonna have a veterinary pathologist take a peek at it. So it's gonna kind of give some clues as to what's going on. Oh, good piece. All right, we're gonna paint it.
Oh, she's like, I don't know about that.
I'm gonna chrome you up. All right, little aluminum bandage.
Okay.
That'll help too.
I just want her to get better.
Yeah, I know. We'll get there.
I hope that the biopsy shows that it's just a bacterial skin infection. Hopefully, treating with antibiotics, we can correct the problem pretty easy. The biopsy should be back in 5 to 7 business days.
Okay.
I'll be in touch, okay?
Yes, ma'am.
So how many should you have in total?
125.
Mary Morgan and I are going to count the hens to make sure that the pinwheels are working and that everything's doing what it's supposed to do.
125?
Yeah, it's hard to...
It's a lot to count.
And it is. It's hard to count them because as soon as you get a group, then they all go,
Yeah.
and then you got to start.
Well, this should be fun.
The egg production is down because of the hawk. It's devastating. It eats into your business, and I don't like it at all. I'll count and you count. Let's just walk through and see what we got. They're not gonna stand still for you to count every single one of them.
I'm at 66.
I was at 62.
But I have a feeling it's gonna be a very fluid number.
I'm at 86.
I'm at 89. There's a lot of feathers.
Now that's a little concerning. There's feathers everywhere out front here. I'm thinking that the hawk is probably back. That's not good.
Were they here this morning?
Not this many.
I can tell how frustrating it is that her tactics aren't working very well. Sharon works around the clock to take care of her chickens.
Oh, there's feathers in here too.
Oh, no.
It looks like the pinwheels worked for a little while, but...
Oh. We'll figure it out.
Yeah, but I'm running out of tactics.
Well, I want to make a scarecrow.
Yeah, that ought to do it.
It should.
That would be my last tactic. That would probably take care of it. Then gotta protect the girls.
Yeah.
Charles and I are going to check on Callie now. I'm a little worried about her, and especially in terms of her pain. We see that she's down at this point, so our plan is to approach her in a very calm and slow manner. I want her to stay down so I can examine her foot. Just put that down and then see if you can't go up to her and get a halter on her.
Yeah, yesterday, Callie, she literally almost ripped her whole hoof off. That's a pretty severe injury, and especially on a big cow like she is. So we don't want to make her get up and walk on that sore foot.
Today, Callie is acting kind of aloof and doesn't want you to touch her.
You know, I didn't get hardly any sleep worrying about her last night.
She's getting that, I'm gonna get up, look in her eye. We have to work fast in this situation. We always say you gotta keep your head on a swivel because these large animals can hurt you if they want to.
It's okay, girl. I'm sorry.
In the past, I've been kicked multiple times in the gut, in the chest, by an animal that is in pain. So you have to be very careful. 1, 2, 3.
You know, I didn't get hardly any sleep worrying about her last night.
I'm pretty nervous because I have no idea what's under that bandage. And I'm really concerned because the possibility at this point is infection in that foot.
It's okay, girl. I'm sorry.
I get the wrap off. I can see the hoof wall at the top of the coronary band or the nail bed is completely removed all the way down to the sole or the bottom of the foot.
It did not bleed a whole lot more after what we did yesterday, which was good.
Yeah.
The problem is you can't suture this. It's gonna have to heal from the inside out. So some concerns that I have, one is how long this is gonna take to heal, if it's gonna heal. Infection, there's so many unknowns and great concerns with it. We'll just have to see.
This wound is absolutely, could be life and death for Callie.
So if it doesn't grow back the way we need it to,
If it doesn't grow back and we are unable to manage her pain and it's not growing in an effective manner, we may have to consider putting her down. We have to look at her quality of life. That's what we have to look at.
Yeah.
So we'll just change it daily and take it day by day.
because cows put all their weight and pressure on those front two, especially when they get up and they sit down. So anytime there's a foot injury, we take it very seriously. We knew it wouldn't heal overnight. You know, at the end of the day, we could lose her, which is crazy for me to even fathom. It's on you, Callie.
Hey, Lovey. When Dr. Jennifer was here 2 weeks ago, we took a biopsy off of Lovey's front feet. Dr. Jennifer called me back and said there was nothing conclusive for any kind of fungal growth, for any kind of parasitic growth. Lovey still has a little bit of infection in her hind feet. Her front feet are better, and she moves around much better than she was moving around. She's very sweet. Lovey's very sweet. When one of them requires a little bit of extra care, you develop more of a bond with the animal. I don't have any more cookies. And then there's some days where I'm like, Lovey, just get out of here. We're done. Get out of here. Come on, babies.
How are you?
Hi, good. How are you doing?
Good. So we're gonna recheck Denver.
Okay.
Do we have anything that's been going on between last time and
she
today?
seems a lot better.
Okay. Well, we'll let Jennifer take a look.
Okay.
In the back end?
Yep.
Okay. All right. Let's see, Denver. Let's put this on. Denver's back today. Jennifer's gonna recheck the anal glands, and we sure hope that her condition has improved. Let's go see Dr. Jennifer. Do your business. Good girl.
Well, hello, Denver. How are you doing?
Doing good.
What'd Kelly say?
She said she thinks she's doing a whole lot better. There hadn't been any issues.
No chewing in her rear end or anything?
Nope.
Yay, are you excited about we're checking your anal glands today? Yay!
Yeah, good girl.
Rechecking Denver today, we see that she's happy and excited, and her owner, Kelly, is telling us that everything seems to be good. Yes, I'll give you a treat afterwards, okay? I do want to be cautious, as sometimes persistent and reoccurring anal gland infections can mean something more serious like cancer. Here, let me pick you up.
Oh, okay. Come on. You gotta stand up. You gotta stand up. No, you gotta stand up.
No.
You need help? Or you want to get her?
It's okay. You're okay. Let Miss Sharon hold you.
Good girl. When Jennifer gets out the cream, Denver's like, something's up. And let me tell you, people, if somebody's on my backside, something's way up.
Oh, it's okay.
I don't think
No,
so.
you're okay. When you're checking those anal glands, if they're firm and hard, you always want to do a recheck. And at recheck, if we palpate the same, then we want to do a biopsy. I feel the scar tissue in there. Denver has had a persistent anal gland infection, and we now hope it's under control. I feel the scar tissue in there, which she's had so many anal gland issues, I'm not surprised. To be cautious, we want to make sure and recheck Denver's rear end to make sure we don't have any other issues like cancer. No, it feels much, 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 much better.
Let me tell you, I'm glad I'm not on the back end of this situation, and Jennifer is.
At least I have little fingers, right? Let me give you a courtesy wipe. She was a little reactive more so than she was last time, but I think it's because don't touch me, I don't like my butt touched, which I don't want my butt touched either. I'm not so worried about cancer at this point. The inflammation has dramatically reduced. With cancer, it would definitely get bigger. Good girl.
She was okay. Okay.
Yay, you're okay! Yay!
See, it's all done.
Yay!
It's all done. Hey, Mary. What are you doing?
Wait till you see what I've got. Sharon wants a scarecrow because it's our last-ditch effort to try to protect the chickens from this hawk. I've been working real hard on this.
Oh, my gosh.
Does it look just like?
Awesome.
What do you think?
Job. Oh, my gosh. It's Charles. What could be more better than Charles to scare off the predators?
He's probably missing this shirt right about now.
He's even got hair on his chest. I don't know if he has hair on his chest or not. That's for Mary, but it has hair now because he's got hay tufting out. So it's fabulous. High five, you did great.
Thank you.
No back talk out of that one. Oh, that's hysterical.
I just thought it'd be fun to make the scarecrow look like Charles, because anytime I can poke at Charles, I will. He needs it.
Get under his skin. Hey, Charles, I want you to see what your wife has done for me.
I've been working really hard on this.
What, is that my overalls? That's pretty funny.
Have you been missing some clothes?
Man, you're killing me. I've been wondering where that shirt has been. At least I can say that I contribute daily to the chickens now. Could have gone a little bit tighter on the waist.
Oh, okay, well.
I got a hairy neck.
We'll stuff some of the hair in. I tried to make Charles a little muscular up top, but it actually just looked like he had a lot of chest hair coming out.
Well, can you get it in
Yeah,
right
you
there?
think you can help us get it in the ground? I do need a hat. Let me take that one.
Pretty good looking scarecrow.
Yeah, we'll see if it does the job or not.
Scarecrows have been fending off predators for ages on farms. I don't know how long it'll last, but I think it's gonna be our best shot right now. All right, I got work to do. I'm headed back to the barn.
Yeah, we gotta go.
Party's over. Let me get my hat. They're not gonna take that from me.
Here she is over here.
It's been about a month, so we're checking on Callie. She literally almost ripped her whole hoof off. That's a pretty severe injury, and especially on a big cow like she is. So wanted Jennifer to recheck her.
It looks like that hoof wall's grown down some.
I mean, that's really come a long way. She's still a little bit sore on it, but getting around pretty good.
You know, it's like when you quick your nail, you
Yeah.
can still use it, but if you start using that finger a lot, it gets real sore.
Yeah. Get her in the corner down here and she'll cooperate a minute.
Well, look at her moving right there. She's not hardly limping. When she first injured herself, you could see 3 by 3 inches of open tissue. Now it's contracted down to about 1 by 1, so that's progress.
No, she's come a long way from pulsating blood out of her foot.
Yes, I'm shocked, aren't you?
Yeah. A good doctor and a good handler goes a long way.
After all these years, it gets in your blood. It's one of those things that you just wake up every morning and it's good to be alive. You've got nature, you've got animals that are depending on you, and it just makes you feel good to produce the milk and produce the fresh eggs. It never gets old.
One of the hardest things in the world to do is a family business, but this has been our family farm for almost 200 years, so that's what drives me, you know, because so many of these farms are dwindling by the day. And so at the end of the day, we all know what the common goal is, and it's getting it ready for the next generation and working as a team.
And we don't take it for granted.
It's not easy waking up at 4 o'clock in the morning. It's not easy walking out of the house at 11 o'clock at night because a cow is calving and she needs assistance. But we chose this life and we love it, and that's what we want to do. And the gift that we have is, as my dad has always said, you get to live here. That's what feeds our soul.
It's a wonderful life. There's a movie called that. Well, this is it, people.